Economic challenges in Nigeria have caused a strain on people's pockets, but the situation is also having a direct effect on health. The rising cost of living means people are having to pay more or even go without their much-needed medication. And even the drug providers are not immune, as DW's Olisa Chukwumah reports.
Toyin Ogundeko has been living with asthma all her life. Her son also suffers from the condition, but she is no longer able to buy the inhaler she needs because medicines in Nigeria have become so expensive.
With the way the economy is going, things are really getting tough. You know, you are struggling to buy food stuff and you're also trying to stock up on your medication. So for me, I can cut down on the inhaler for myself. I won't cut it for my child.
The cost of medicines has gone up because of inflation and the volatility of the exchange rate. This has made it more expensive for Nigeria to import drugs from abroad. The result has been a scarcity of basic medicines and higher prices.
Drug prices in Nigeria has been on the rise since 2013. That has now tripled due to current inflation rates. This antibiotic used to sell for around 1,000 naira for a full dosage. That was less than $1. But now sells for 9,000 naira. That's about $6.
The shortage of medicines has also become more acute since several international pharmaceutical companies left Nigeria because of the economic conditions. The government has promised to invest more in local drug manufacturers, but many fear that may not be enough to plug the gap.
Well, there is a limit to what local manufacturers can do. We are grateful to have the likes of Emzo Pharmaceuticals and some other products, some other indigenous manufacturers in the country. But there is a limit to what they can do.
The economic hardship is linked to the decision to remove the fuel subsidy. The government says its reforms will improve life for citizens in the near future, and that the cost of living crisis will eventually ease. But like many Nigerians, Toyin needs a solution now.
People have all sorts of complicated conditions, and imagine how they are coping, you know. So for me, it's a plea to the government, whatever needs to be done, first, find a way to stabilize this economy. Things are going out of hands.
For Toyin and others who cannot afford medicines, this is a challenging time.
Let's speak now to Dr. Odunola Olabintan, a medical doctor and team lead at Health City, a tech-enabled social enterprise in Nigeria. Good to have you on the program, Odunola. Now, can you tell us about the current state of things? From what you've witnessed, your operations, how are Nigeria's current economic problems impacting the access to health services and medicine for Nigerians?
So things are currently quite hard. For some people, it's even difficult to buy food, not to talk about medicine. So for most people, they have, gone back to self-medication. And self-medication, not just using, quality medications, they use substandard medications, and they also have resorted to using things like herbal medications, which we commonly call agbo in Yoruba language here in Nigeria. And, the problem with agbo is that you don't really know what's inside. But because people have no choice, these things are cheap and readily available. They don't have to consult a doctor or pay for consultations before they use it. So they revert to using things like agbo. And for some people that have, severe problems, like maybe someone has an accident and maybe their bones get broken, instead of going to hospital to get, proper orthopedic care, they have, to go to traditional bone setters, because those people are infinitely cheaper than going to hospital. So the effect is, it's enormous, and we can see it clearly.
And how are you able to advise people? Because you do give people health care advice. How has this affected the way you relate and engage with people?
So the way it has affected the way I relate with people, especially my patients, is that now you have to sort of prioritize care. You have to explain much more agile than you would have in time past. why the medications you're prescribing are important and why they must get them. And you also have to understand the financial difficulties your patients might be having. So you would prescribe a cheaper brand, a quality but cheaper alternative, and you would also, prioritize the testing you're doing. So you do an hierarchy of testing, and you might be forced to do the absolutely important ones and leave supporting tests that would still improve diagnosis, but you might have to leave those ones out because you are also trying to save costs for the patient, because in all honesty, they don't have the money and they're not insured. So yes, it has to do with, explaining, re-explaining, and, prioritizing different aspects of their care.
And so what policy changes or industry collaborations, or what kind of action do you think is necessary to improve healthcare access in Nigeria in the face of these economic challenges?
So right off the bat, I would say health insurance, right? That's a huge problem in Nigeria. The vast majority of Nigerians are not insured, right? A lot of people pay out of pocket for healthcare, and this creates a vicious cycle, right? God forbid, like someone has a serious healthcare problem, like a chronic problem, like hypertension or diabetes. You have to pay out of pocket for every single thing you do if you're not insured, which is the problem with most Nigerians. So policy-wise, I think the Nigerian Health Insurance Authority has a lot of work to do in ensuring that the vast majority of the population are insured. And also the government has to create policies, that encourage ingrown pharmaceuticals to produce drugs that are, standard for our people. A lot of people rely on much more expensive brands because, there's our own pharmacies, our own homegrown big farmers and those there. So if we have policies that encourage them and provide ease for the business, that will improve healthcare in Nigeria.
Okay, Dr. Odunola Olabintan, we appreciate your insights. Thank you for speaking to us.
You're welcome.